Let's get this started. Hello everyone, and welcome to this very special webinar in which we'll be talking to our partners at Shout It Now, a gender-based violence and HIV prevention non-profit organisation. We'll be using today's session to find out more about the amazing programme they offer to communities in South Africa and how simulation has played an important role in enhancing the vital and inspiring services they provide. In fact, our results so far, just 2 months after implementing some changes, show that simulation has helped to generate a 33% overall increase in productivity, with some instances even seeing a 100% uplift. And we'll obviously be hearing more about that as we go through the session. So who are Shout It Now? Shout It Now deliver a range of free, friendly health services to hard-to-reach communities via its fleet of mobile clinics. These include HIV testing, PrEP, which is the HIV prevention pill, STI screening, contraception, gender-based violence prevention and counselling, and educational life skills programmes. And to demonstrate just how vital these services are, we only need to look at the harrowing statistics. South Africa has the largest population of people living with HIV in the world, with 1 in 5 living with the virus. And at the same time, 1 in 3 women have experienced gender-based violence. This year, Simulate teamed up with Shout It Now as part of our Tech for Good programme, offering our simulation software pro bono to help the non-profit improve its delivery mechanisms and overcome logistical challenges. To tell us more about how our technology has been put to use and the impact it's been having, I'm absolutely delighted to be joined by William Taylor, who's Head of Operations and Innovation at Shout It Now, Bootley Satoli, who is a registered nurse and Shout It Now's Quality Assurance Officer, as well as our very own Andrew Wiley, a Simulate consultant who's been working with the non-profit on building a model that helps maximise resources to enable it to reach even more vulnerable women. So hello everyone. In a moment, I'm going to go around and ask each of you to introduce yourselves, but first let me quickly outline the agenda for today's webinar and run through some housekeeping. So once we've met our speakers, William's going to tell us more about Shout It Now and their wonderful team, including their approach to technology and the role it plays in making their services as effective as possible. Andrew's then going to walk us through the model and explain in detail about how simulation was used. William will reveal the results and the ROI impact, while Bootley can give us some insights into the real-world impact, which I'm really looking forward to hearing about. At the end, there is going to be an opportunity for a Q&A. So if anyone has any questions, you can simply write them in the Teams chat, put them in at any time during the webinar, and our team is going to collate them for the session at the end. We'll answer as many as we can, and any that we don't get to, we'll try and share the relevant details after the webinar. I probably don't need to say this, but I'm going to, but just a friendly reminder that the chat will be available for everyone to see. So please keep all your comments and questions respectful and focused on the themes of today. And in terms of our theme for today, as well as learning about Shout It Now, the webinar is also designed to provide a really interesting case study on how simulation has contributed to successful optimization. So we're going to be prioritising the questions that look at that in more detail. With that in mind, we really do want to make this as interactive as possible, so please do join in with your questions and comments as well. Finally, we'll be sharing a web link with all of you that will have lots of extra details about Shout It Now, including how you can offer your support, and also about Simulate's Tech for Good programme, and we'll send that link round after the webinar. So right, I think we're on to it now. So we're going to begin with a very quick round for everyone to say hello and introduce themselves. William, could we start with you?
Yes, thank you, Laura, and welcome to everybody. I'm Head of Operations and Innovation for Shout It Now. I make sure all the vehicles can go out into the field and service our clients.
Thank you, William. And Bootley?
Hello, everyone. My name is Bootley Sithole. I'm a registered nurse by profession, and I'm working for Shout It Now as a Quality Assurance Officer.
Thank you, Bootley. And finally, Andrew, can you tell us about what was your role in the project?
Hi there. Yep, I'm Andrew Wiley. I'm one of the simulation consultants here at Simulate. So my role is to deliver projects across a wide range of industries, including manufacturing, healthcare, and in this case, in the charity sector, particularly with healthcare. So my role was to collaborate with Shout It Now, understand their process, break it down, and ultimately build a model, so a virtual representation of their system, whereby we could see what problematic areas we might have, so what we would call bottlenecks, in a way of increasing how many people we could get through to use Shout It Now services. So looking forward to today's session, Laura.
Okay, thank you. Thanks, everyone. So now, William, over to you. Can you please tell us a little bit about the background to Shout It Now and the specific problems faced by communities in South Africa around HIV, sexual health, and violence against girls and young women?
Yeah, certainly. So I mean, Shout It Now is a non-profit organisation funded through PEPFAR and CDC. And we really are here to try help the young girls, and we empower them to have bold conversations about sex and relationships. So if you look at some of the stats that you started speaking about earlier, so the next slide, please. So as you were saying, there's 1 in 5 people live with HIV, 1 in 3 women have experienced gender-based violence. And the reason we target the 15 to 24-year-olds is because the young women are 7 times more likely to get HIV than young men. And on average, we're getting 200 plus women diagnosed with HIV each day. When it comes to gender-based violence, the stats are around about 46 sexual offences and about 116 rapes in a day, which comes to about 6 cases every hour. But take into account that is only reported cases. We know there's a lot of cases that are not reported, so those won't form part of this stat. So it is quite a challenge that we actually have here that we have to deal with. So what we do is the services we offer, we actually empower women to make a healthy choice through life skill programs and essential health services. So some of the services that we do is we give them HIV testing, and if they are positive, we link them with either DOH or other partners that can take them further, as we are only a preventative partner, meaning we only try to prevent HIV, we're not a treatment partner. We then also work with PrEP, which is the HIV prevention pill, which if taken daily protects about 99.9% against HIV from sex. So, it's important for that. But part of it is the life skill programs, which is really giving the clients the tools and mechanisms to manage their health and make healthy choices, healthy decisions, but also empowering them with economic skills to hopefully help them actually get a job, because most probably about 90% of all our clients are unemployed and are all young girls looking for work, etc. So giving them those skills to actually get jobs in the future. And we also do men's work with men, and a lot of those men are actually the perpetrators in the GBV and that. So we got programs that actually deal around that as well. Then our gender-based violence, we have social workers on the buses that actually deal directly with clients on the bus, but we've also got some that are office-based that can deal with clients that are not coming to the bus but are phoning in, etc. Plus, one of our latest inventions is Chomi, which is a WhatsApp service that can be used to actually get information, get help for gender-based violence. And if you look at the links that will be sent, you will find more information on that. And then we do contraception as well, because contraception is very much linked with PrEP, because the rate of young girls' pregnancy is extremely high as well. So we do link the two together, and we also do STI screening, because obviously that's a risk when they're having sex in it as well. So if you look at our model, we are very youth focused, and by doing that, we actually, all our staff are also young, and it's to make it easier, because a lot of time when people go to clinics, it's more difficult with older people. There's a lot of stigma still around, so we got a lot of young staff that actually can relate to the clients that we're working with. And they're from the communities, so they understand the communities, they understand what the challenges are in the communities. We also have our own custom-built mobile clinics, and these are designed that they can get to hard-to-reach areas, but they're also funky and bright to attract the young people. With our communication, we very much encourage clients to have the bold conversations, and a lot of our conversation or our media that we release is quite out there, really challenging them to actually talk about it and actually learn more about it. So yeah, that's important. And then we use a lot of digital tools. We basically paperless. We don't use much paper at all. We've got our own custom built systems that we use that are IT systems that we can track our clients. And Andrew spoke about the data that we use that comes from the system. So we can track our clients, we see when they come back, and we use this to make decisions going forward to how we can improve our services to our clients. We've also got virtual engagement platforms where we've got a Connect Hub where we've got staff that will actually follow up with clients and give them support via the phone, via WhatsApp, via social media platforms, but it also gives the option for clients to phone in if they've got questions, etc., and they can link them directly to a social worker, to a nurse, etc., to get what information they need. And then what we've also got is we've got a membership group known as Yakuma Girl, which basically translates to You Go Girl. And that is really to encourage the young girls to, and it's aimed at the girls 15 to 24, and it's encouraging them to take up all the services, the life skills services, the health services, and making them create a journey that's for their future. So yeah, then if you look, we've got a custom built mobile that's, if you go to the next slide, you'll see a picture of it. And that's really what, when we go out, and you can see sometimes we're in very rural areas, there's not much around. Other times we are in more urban areas. But, you know, our challenge was how do we actually maximize the number of clients, where are some of our bottlenecks, what could we possibly change on our custom built mobile as well? And we'll talk more about that later. Thank you.
Well, thank you for giving us an overview there. I know there's a lot more information, as I said, we'll be sharing it later. I think for me, the scale of the problems within South Africa of HIV and gender-based violence was just staggering, and it's something I hadn't fully appreciated till we started working with you. In the time that you've been operating, can you give us a sense of the impact you've been able to have on sexual health outcomes in the areas that you operate?
Yeah, we can. I don't know the exact figures overall, but we have got it later. When I talk about the results, I'll talk about what we achieved in 2021. But, you know, we've, on a daily basis, we must probably, each team has seen at least 50 people or so. Sometimes more, sometimes a bit less, depending. And we normally around about 20 or so people going on to PrEP. And GBV cases vary depending on the areas we're in. Some areas we can get high numbers, sometimes 20 plus, sometimes less, depending on that. Now, you know, it really varies, but I think we've done, I think it's close to 1.5 million in total people we've tested, because Sharon and I used to only do HIV testing before we moved into doing the PrEP pill, etc. So yeah, we've made a huge impact over the years.
That's fantastic. Thank you, William. Thank you. So Andrew, I'm going to hand over to you now, as you're going to give us a demonstration of the model and talk to us about how it was developed.
Thanks, Laura. So ultimately what we wanted to do was build a flexible model that had an engaging user interface. So we wanted to try and capture the colourful nature of the mobile clinic. And a big thank you to my colleague Jessica, who's a fellow consultant with Simulate, who was pivotal in the graphical side of the model. So ultimately what we've got is a great deal of technical elements kind of connecting with each other to representing the different pathways of people coming in to use Shout It Now services. So we wanted to make the model itself as kind of simple as possible at its forefront. So what we have is people coming into the system to use Shout It Now services. So as William mentioned, there's a range of services. So we obviously had to understand the profile of the people coming into the system. So again, we did a great deal of data analysis to establish what kind of services are people using, which area of the country are they from, what age group are they from, what was their gender, what was the potential disease profile, as sorry, these would have fundamental implications for how they moved within the model, and therefore the requirements that they would have, so the resources. So each person in this model has got its own profile. So again, it's age, gender, and where they're from. We found that in the data analysis, a 14-year-old girl from a rural area would have a completely different profile and therefore different requirements to a 40-year-old man from a metropolitan area of South Africa. So the data analysis was critical in getting that done. So from there, as we say, we were able to model the different pathways, people coming in using the various cubicles on the clinical bus, or the mobile clinic, sorry, but each patient had the correct resource assigned to them, the correct timings. So how long do these sessions have to last? Do they have to come back for a repeat visit? Or they have to be accompanied by someone? All of these things were considered with our data analysis, and therefore before we put it into the model. From here, what we were able to do is, once we'd established our baseline, obviously the fundamental goal was to ensure we knew if there was any bottleneck with the system, and could it cope with any increases in demand. As William mentioned, those staggering statistics are obviously only a reflection of the people that maybe reported such cases. So as Shout It Now's advocacy gets stronger, as they get their message out, more people will come and visit their mobile clinic. So the guys at Shout It Now wanted to know that their system was robust to meet this demand, and therefore our model had to be robust and flexible. So if I click on this interface, I can go into, like, for example, my settings, and I can choose my scenario. So and William can potentially elaborate this a little bit better than myself, but we had two main scenarios of the profile of people coming into the system. William, I'm correct in saying the CNT in the community was a completely different statistical profile of people coming in?
Yeah, so the CMT is actually our life skill program. So those are ones that are normally a lot of time run in schools or their particular groups. So you actually got a target audience available already. And we already know for those normally the age groups that are coming. So where in the community side, you don't have any control of age groups or genders or anything like that. So that's why it was quite different. And with the CMT sites, you also got it was more badge, where your community was random. So it made a difference in the scenarios as well.
Thanks, William. So again, that lends itself to just how important it was to, first of all, analyse the data very carefully, and then ensure it was input into the model. From there, so we're obviously able to toggle between this, which the baseline we're taking from, but from there we could obviously make changes. So again, as Shout It Now continues to grow, they might want to say, okay, what would happen if we increased how many staff we've got? Would this have a fundamental impact on the patients that we could see? Again, so this would be the kind of key or some of the key members of staff, a healthcare advisor or nurse. But we could also change the actual kind of structure of the model. So again, in the future, they might want to have either multiple buses or an even larger bus that would be purpose built to have more than 3 cubicles or more than 2 cubicles of each. So graphically, they maybe had 5 cubicles, but ultimately we could flex this to a higher point. So this model's future proof. So as with no doubt that Shout It Now will continue to grow, we want to make sure that this model stands the test of time for them and that they are able to use it independently. And again, with this model, we could also change things like start times, end times. The overall timings are in the background as well. So again, if you maybe, for example, a treatment, they come across a treatment that maybe takes a little bit less time, we can update that automatically. And again, that will be reflected in the results. So what you'll see here is, for example, as the model runs, how many patients are possibly getting an HIV positive result. We can see the utilisation of our staff. So every hour, this is tracked. So again, this gives Shout It Now a very realistic version of day-to-day, hour-to-hour events, which will allow them to pivot on that. So I'll hand back to yourself, Laura, and no doubt we'll revisit the model later on in the session.
Okay, Thanks, Andrew. I actually had a couple of questions for you as you were going through that. You talked about making the user interface engaging. For our Simulate users in the audience, what features did you find were critical for that?
So in the background, we have got visual logic, a lot of visual logic running. Which is our own coding language. This allows the already powerful fundamental features to be even more flexible. So this was one of the main tools we used. Dialogues is what allows us to use allows us to choose between different levers. So for example, how many resources have we got? What's the frequency of patients coming into it? What percentage of patients are within this age group? Which percentage are in this age group? So again, this was all controlled by dialogues. But to be honest, it is the pathway itself was built with our basic building blocks. These were built with activities to represent the kind of active process, resources to represent our staffing, and queues to represent waiting time, which again would be something to improve the client experience. We want to make sure that the people using the service could be seen as quickly as possible, although obviously in an effective manner. So those were some of the main tools.
Okay, and I thought it was a nice touch when you said about also trying to match the look and feel to the sort of look and feel of Shout It Now. William, did you want to add something there?
Yeah, I think the one thing as well that really we liked about the way it was designed, and that it meant that somebody could actually run it without really knowing the visual logic behind it, because the interface was very simple for them to actually just be able to change it. Plus, in the background, it's linked to Excel spreadsheets where we can actually then update the data. So if we then run new data, we can say, okay, now the times have changed or whatever, because there's some change in the protocols, whatever. We can update it there, and immediately the model gets updated based on that. So, when Andrew and I were working together on this, we tried to make it, as you said, future-proof and easy enough so they don't need to always rely on us, but it's there and makes it easier for somebody else to use it as well.
Fantastic. That makes sense. And I had one more question actually about the data, Andrew, because you said one of the challenges was about analysing the data so that the model reflects the experience of the different population groups. Any learning points to share on your data analysis?
Yeah, it was a nice test for the old data analysis skills. We have got obviously a lot of data coming in, and thankfully it was actually formatted very well, so that took a large part of time out. But essentially, we did have to go through it systematically to ensure we were analysing the data with driven by the correct factors. So we had decided through the collaboration that age group and gender would be the kind of key driving factors, and from there we would aggregate the data to reflect that. So yeah, that was very, very important. It was just as important as obviously getting a user interface, getting the pathways correct. We really wanted to reflect the experiences of the population that uses Shout It Now's vital services.
And what did you do your analysis in?
I used largely Excel. Okay. Simulate has obviously also got its StatFit tool. So some of the larger distributions that we were building, I would build using StatFit. So again, maybe things like arrival rates. I wouldn't probably be able to tell a very complex distribution off the top of my head. So StatFit allows us to actually do that. So okay, hopefully someone puts a little link in about that as well, because it is a very handy tool.
I've got a stats degree, but I must admit you do forget it quite quickly if you're not using it. So good to have StatFit there. Okay, we're going to move on to the next part of the agenda, which is William. We're all, as I mentioned at the beginning, we're only 2 months in, but we do already have some results to share with everybody. So I'll hand over to you.
Yeah, thank you. So yeah, this is just the overall feedback that we got, and this is basically we looked at how many they're doing on average per day. And so obviously some days use better than others, whatever, but we took the averages before we made the changes and then after we made the changes. So you can see, if we look at the HIV testing, which is HTS, there's it varies from like 8%, 9%, all the way up to certain ones, 123% and 127%. Now, those two regions, Dr. KK and NMM, are in our very rural areas. So where your Tshwane and EKN is more your urban areas. Bonjinalo is a bit of a mixture, so that's why they're in between, but those two, NMM and Dr. KK, really are the outlying rural areas. When we looked at PrEP, you can see as well, the increase varied from like 11% all the way up to 50% increase. And, you know, when we look at our overall stats for October compared to previous years, this was our best ever October when it came to making our targets, getting our numbers, etc., because of the changes we put in place in that. Now, you know, some of these things we might have thought, yes, might be some problems there, but we like to make decisions based on data and fact, and that's what Simulate gave us. Based on that, we could actually clearly say this is where we need to make changes. Now, the gender-based violence, you can see that some didn't have really increases, some had more increases, some up to nearly like 100% increases, and we largely attribute that to being that clients were not happy to wait to see somebody because they would actually just not want to wait and walk away, so they wouldn't actually see a social worker. So obviously now having better time, less time with waiting, it means that there's more clients can be seen, there's less waiting time, less clients leave us in that. And you know, one of the other things that we also found that's not on the stats yet, but is like contraception, where you might have had somebody wanting to, that's possibly had been raped or something like that, and now they've had to wait, and they didn't wait, and they walk away. And there's multiple issues there, obviously, from a gender-based violence standpoint as well. But we also wanted to get him onto PEP, which is the HIV prevention for after being raped, etc. type thing, and possibly staying for pregnancy, etc. So those are things that we picked up from these actual stats. Yeah, so if you just go to the next slide, you'll see overall some of what we achieved in 2021, and you can already see based on those increases, we're going to do even better this year. We had basically 74,000 clients that learned their status through Shout It Now. We had about 3,400 survivors supported with gender-based violence. Now, that is what I just want to say there, those are ones that will actually identify that is gender-based violence. There's a lot of other issues that we deal with as well. So most probably our social workers most probably saw double that amount of people that they actually spoke to. So there is a big difference there as well. We found about 31,000 clients that went on to PrEP that were at risk. And then, yeah, about 82,000 reached through the life skill programs during that period as well. So you can see it's a huge impact just in 1 year, and that we can see is increasing. And obviously, the more funding we get, the more buses we can have, the bigger impact we can have as well. But that's based on our current funding.
Wow. Okay. Very powerful numbers there. You mentioned when we were on the previous slide about the rural areas. Why is the improvement in rural areas of particular importance?
Well, the rural areas, a lot of time the problem there is people can't get to clinics, they can't get to where there is support, etc. And what we found is, based on some of the data, and that is actually we needed to change where we put teams, and we actually increased the number of teams in those areas. That's why like in Dr. Caker, we got two different size buses currently. One is a big bus that actually has 5 cubicles, and then we got the smaller bus with a truck with 3 cubicles. Now in Dr. KK, they only had one of the big buses. What we did now is we're putting there 2 smaller trucks, which means they can go to more different areas at the same time. And we've increased the number of nurses we've got on each of the vehicles. So each vehicle now has 2 nurses, where previously we only had 1 nurse. Immediately it's been able to service more clients. In NMM, we only had 1 small truck. We've added another small truck there as well. But a lot of those, to understand the sort of areas they work in, a lot of time they're driving possibly between 30 minutes to more than an hour to get to the areas they're working in. And they're small communities, and sometimes between the communities and the next town is quite a big area. There's nothing there, just open areas. So it's it's rural. There's not many set up clinics, etc. And there's some small clinics, but they're understaffed a lot of time as well. So they cannot necessarily deal with it all and that.
Okay, that makes sense. And What would you say is the number one benefit the simulation has delivered for Shout It Now?
Well, I think, obviously the increase in numbers and being able to reach more clients, help more clients is critical for us. But I think when Bushley talks, she'll tell you about some of the advantages for the staff and that as well. So I'll leave that for her.
Okay, well that seems a good point to bring you in then, Bushley. As one of the key people on the ground, William just mentioned there it's had some impact on the staff. Can you give a couple of examples of how the results from this project have changed things on a day-to-day basis for the team?
Okay, thanks, Laura. As William has mentioned, our main aim is to actually reach as many clients as we can. And one of actually my roles as a quality assurance officer is to make sure that our clients actually get the premium or a luxury service from our mobiles or our teams. So one of the impacts that I've noticed is actually that now our staff is actually more happier. Our staff actually has time to go on lunch, compared to before we interacted with Simulate, where you might go on site and then you find even the staff is actually frustrated because there's a lot of clients, time management and all that. But since we've been working with Simulate, there's sort of some time management where our staff actually has more time on their hands, meaning you actually get more friendlier if you're not hungry, and also it also allows me to actually do my job more effectively, because that means I also get to interact with the staff. I actually get to know any queries or any issues from the staff, compared to when our staff doesn't actually have time to, have a chat with me or whatsoever. And also our biggest impact that I've also noticed is the fact that our clients are able to trust us, and our clients can actually just choose us. They would be like, you know what, instead of going to anywhere else, I'd rather go to Shout It Now, because I know that their services are actually quick and they are youth friendly, and I know that whatever help that I need, I'm going to get it within a specific time, and my service needs are not going to be delayed in any way.
And you mentioned that it was interesting because you're talking about what you provide for the clients, and really surprising almost to hear you use the words premium and luxury. Why that?
Okay, so we do that so that our clients get a sense of belonging. You know how you'd feel if you walk into an airway and everyone is actually just smiling at you, or if you walk into a shop, for example, and you don't actually ask someone, where you don't walk up to someone and you be like, oh, hi, ma'am, I'm looking for the aisle where I can find sugar, but actually someone approaches you to like, hello, ma'am, how are you? How can I help you? Or what is it that you may need from us today? That is the type of experience we want for our clients, because it gives them a sense of belonging and it gives them a sense of worth. And they also feel actually important, that, oh, someone actually cares. They just saw me walking and they felt that they need to approach me. They need to ask me how they can help me. I didn't even know that I needed such help until this person approached me. So we want that experience for our clients.
And that experience is important because so that they come back again, or is that the main reason?
That could be the reason, but the main reason is for the clients to feel important more than anything else, because it then makes it easier for us to provide the type of services that we provide. If you don't trust me, I don't think you'd trust me to do an HIV test on you. And if I gave you an attitude from the beginning, or if I didn't trust you at all, there's no way I'm going to allow you to talk to me about PrEP or contraceptives. And if I don't even trust you, or you gave me a funny face the minute I was walking by, I don't think I'll be able to actually come out and tell you that I'm actually experiencing, gender-based violence. But the minute you approach me with a smile and you're just like, oh, hello, ma'am, how are you? You actually look pretty. Oh, how can we help you today? We Shout It Now. This is what we do. As a client, you're actually going to feel at home. And then you're going to, once I list all the services that we can help you with, even though you were not willing to open up about it, the fact that you feel at home, you feel welcome, you trust us, you have a sense of belonging, it's going to be easy for you to actually be like, oh, now that you mentioned GBV, actually, this is what I'm going through, then we are able to assist you as well.
Thank you for sharing that, because you know, I've done simulation models. I know a lot of our audience does, and we don't often get to hear the impact of what we do. And particularly a couple of things I took from what you said there was about the trust this helps you to build up with your clients. And then also something else I thought was really powerful there. You said it gave you the time to do your job. So really, yeah, thank you for sharing that. That was good to hear. Okay, so we are sort of closing in on near the end of the webinar now, and what we'll do is, before we go to questions from the audience, I'd quite like to hear sort of from Andrew. Could you give us your final thoughts on what it's been like to work on a project like this?
Yes, no problem at all, Laura. Ultimately, despite the fact that it is such an emotional topic, such a serious topic, it has been something that I've enjoyed working with the guys at Shout It Now. I can't really describe my level of admiration for them, and it really has been a joy to work with them. I very much like to express the desire to continue doing projects like this. Simulate obviously has got our Tech for Good programme. We are very passionate about helping. It doesn't matter if it's not the massive corporations. We want to help everyone through the power of simulation. It very much is a project I'm very proud of, and I couldn't admire the guys that Shout It Now more if I tried. Sorry. You're on mute, Laura. I thought I left you speechless there.
I hit the button. I got it. I did hit the button. Honestly, I didn't forget. No, that's fantastic. Thank you for sharing that. I agree. It's so powerful to hear and see the impact that simulation has had, and get to know more about Shout It Now and what they do. And William, Shout It Now are doing some amazing work, which we scratched the surface on today. And I'm obviously so pleased that Simulate have been able to play a part in your success. But I know myself, because I'm involved with other, not-for-profits, that there must be a constant worry about funding to continue all this great work. Can you let me and our wider community have a sense of how governments, NGOs and corporates could support you? And I think specifically corporates, what kind of support can we offer? What do you think the benefits are for organisations getting involved with Shout It Now?
Well, yeah, I mean, Simulate, for instance, this isn't the first time we worked with Simulate. Simulate helped us years ago when we did a different project, and they actually helped us with the simulation model for that. So, it's a continuous support, and, there's companies, because we're like a tech-based company, obviously there's companies that can help us in that sense, etc. And it could be by discounts or donations of equipment, etc. But we're building new mobiles to expand, which is also based on the simulation model, that we got a new bus coming out, one with 6 different cubicles compared to the 5 that we got now, and that was based on the data that we got as well, that the one more cubicle would make quite a big difference. And there's things like that. If there's somebody that maybe could actually sponsor a bus for us, etc. type thing, because we're actually expanding, and we're building one of the buses with the bed, so we can actually expand our services. But there's so many different resources we use, and from a corporate point of view, it might be saying that you're from a medical background. It might be saying, hang on, this is stuff you use. We can have part of a donation to you regarding that, or we're from a motor company, maybe we can actually help you in that sense, etc. So there's multiple ways, and obviously, we also do services for companies where they can actually say to us, yeah, come service our clients and we'll pay for that service, so that it actually covers our cost for doing those services as well. So there's multiple ways people can get involved.
I mean, hopefully our audience have heard today how much Simulate have gained from doing this. And as I said at the beginning, we'll follow up with more information in terms of how you can contact Shout It Now if you or your organisation would like to, see how they can support the organisation. So we are now going to move on to our Q&A. And first question I've got, which is probably directed at Bootley and William. So this is about sort of bus utilisation, obviously bus and service percentage. And somebody's asked, did you consider the route of the bus, i.e. should it be people to bus or bus to people?
So yeah, I mean, we actually with that, I mean, I would say that we did look at it, but I mean, it's easier for us to take the bus because most of the clients don't have ways of actually getting anywhere. So for them, if they're unemployed, they don't have money to actually get onto a taxi, for instance, to get to where our bus is. So that's why we move around, and sometimes it might be 2 different places in one day. So we actually taking the service to the client, and that's why we went with the using the buses and not trying to get them to our buses. So we actually take the service to them because most of them don't have access to get to our buses. That's if I'm understanding the question correctly.
Yes, no, that makes sense. Question for Andrew now. Andrew, did you have to take a different approach in any way to this project as you would with your typical consulting project? So I guess, was it atypical in any way?
The atypical element will be obviously how emotional a topic it is, and how we had to kind of respond to that was still maintain the objective approach of simulation, management science, operational research. So we still had to treat the project like any other project so that we did things correctly. We did things very kind of meticulously. So in that case, yes, it was different from like a kind of emotional sense, but we still approached it through the data analysis, through building a baseline model, and making sure that it had an engaging user interface, and throughout ensuring that we collaborated with the client. I suppose the other atypical element was the guys at Shout It Now were obviously, they were very grateful throughout, so I was always pushing them to give me a hard deadline on things, because they were like, oh no, thank you for doing this, and I'm like, no, let's get this done, let's hold me to a tight deadline, please.
You're not saying some of your clients hold you to tight deadlines, are you?
No, never.
No names, no names. Question for you, William. This is a very different use case for simulation. What drove you to use simulation?
Originally, when the first time we worked with Simulate, we were actually looking at designing. We did a complete different project, was different from anything we did. And previously, we had basically done on the back of a cigarette box type calculations and that. But then we spoke to people at one of the universities here in South Africa, and they actually referred us to Simulate. And that's when we then started talking to people from Simulate and saw what they could do for us. And yeah, it was one of our best decisions actually doing that, because it gave us such a huge scope, not just then, but also now the changes. And as Andrew said, we'll continue working because there's other things we're looking at that we will see how we actually work together to make it better in that. So yeah, it just made it, and to me it was just very simple, easy to understand, and they were happy to understand and look at what we wanted. It wasn't like saying, this is the way you got to do it, which is the way some companies unfortunately work. So
good to hear. This one's for Andrew. So I'm just looking over to read the questions that come through here. In your simulation, did you also include cost versus volume simulation analysis? Because value for money is quite an issue for funders and SAG.
No, that's a great question. The main KPI we're looking to test was clients through the door, people able to use Shout It Now service. So it was very much volume driven and throughput driven. Though Simulate does have the ability to cost basically every single element within the simulation. So for a potential for maybe a future step, if funders did require that, it's definitely something that we could layer the model with. From a value for, oh sorry, Will,
yeah, so maybe I can just add there. I mean, we got a costing model that we already use to do our calculations. So we actually use the output from Simulate into that. So we didn't actually use the one on Simulate because we had the one that we had already done, but agree that in future, I think it is saying we could look at using completely there, but we did actually use it for costing from our side as well. So we took the output from Simulate for our input as well.
So it has been through that process, yeah. Okay, thanks for sharing. Another question here, how important was the graphical interface for stakeholder engagement? And also, this is an interesting take on this because we talk a lot about stakeholder engagement. Did you also find it helpful for managing their expectations and what else simulation could help with? William first, yeah.
Yeah, so I think, I mean, from my point of view, the graphical interface made it, when I look at it as, I come from a tech background as well. So, it's easy for me to understand a lot of the other stuff and working with it. But I know if I look at a lot of the other people coming that we work with in our environment have more of a medical background maybe in that. So they don't necessarily always understand the technology side of things. So with that graphical interface, it's simple for anybody to understand and see, and it makes sense for them. Where if we didn't have that bus that was saying that people could actually relate to, it wouldn't have the same impact for people. Because when we showed it, people were like, wow, because it actually, I can imagine that. I can see exactly how people were queuing up for the bus, etc. type thing. So that to me is what the graphical interface did compared to just having the standard one. When I look at it, I sometimes will look at the other side as well to understand certain other things, because that's where me and Andrew worked in that. But when we distribute and show it to other people, they like the graphical interface. It makes it much easier for them to understand.
Was it something you saw, Bootley, during the process? Did you see the simulation?
Sorry, I didn't hear you there.
I was wondering if Bootley had seen the simulation, and if you're part of the group that saw it during when it was being built. No, okay, right. Okay. Andrew, would you add anything then if you're involved in any sessions with stakeholders?
Yeah, I mean, we obviously got the personality of Shout It Now throughout our sessions, and again we wanted to translate that into the user interface with the colourful mobile clinic. Ultimately, what we do, we establish what the most important KPIs and levers are, and we ensure that those as a minimum were in the model, and our graphical interface is managed to capture that. So again, changes into the population, changes into operating times, changes to resourcing can all be quickly put into the model.
More questions are flying in now. Given the problems with the global economy, would that restrict Shout It Now being able to expand and meet demand and pay more staff, or are you all voluntary so that doesn't impact as much?
No, unfortunately, I mean, our staff are paid, so it does have an impact. So obviously, but we do see it, of our funding that we did reduce, for instance, to this year, and that's why we had to streamline, and with the simulator actually helped us with that model as well to understand that. But, it is saying, unfortunately, the global economy is going to affect us because we rely on funding from either people like CDC or from other governments or companies, etc. So yes, it does have an effect on us, and things like fuel prices, everything going up affects us because of the mobiles going out the whole time, etc. And with our newer buses and that, we don't run generators; they're all solar powered, etc. type thing. So we're trying to cut costs where we can, but at the same time, obviously, setting up then costs a little bit more in the beginning, but yeah, we are trying whatever we do to cut costs on that.
Okay. One last question here, which is somebody was interested in, did you consider scheduling clients coming into the unit? Would that have been feasible?
We do a certain amount of scheduling in that with our follow-ups, our clients that come back, we actually schedule appointments for them, but it's not necessarily on time because our clients, some of them are at school, at university, so sometimes their time has to be a bit more flexible. And yeah, it's not always that easy. We can do it. Our system can actually schedule it, but it doesn't always work for our clients. And we always look at it as what works for our clients. A lot of our clients they like to actually just arrive and come see and actually take up services. Some of them we will schedule, but they'll normally say, yeah, I'll be there between 9 and 10 or whatever the case is. It's not normally particular schedules like you would have, but we do schedule based on overall times.
So it's very much driven by what your clients are able to do and what to manage. So, and then I think there was a follow-up to that, which was somebody had asked, I'm not completely sure if I'm getting this question right, so whoever asked it, please put in the chat panel if I've got this wrong. But let me just read this. Yeah, is there option to add location alternatives so that services could be more centralised or be optimised to location?
We do, yeah. So basically,
I see you both smiling there.
So yeah, we've got a GIS system we use as well, and that we use to obviously track our mobiles, but we also plan around that. And what we do for follow-ups, for instance, is we actually look at that and we say, okay, in this area we've possibly been to 3 sites, but there's only like 2 clients there, 2 clients there, and instead of going to each of them, we find a central one, and we actually then get them all to come to that central point. So we do that, and based on sometimes, we have problems where we can't necessarily go into the school, so we've got to find an area close by. But we have a GIS system we've developed as well with a partner that we actually, can actually do that sort of thing, because we can actually see where it is. We can see where like clinics are, where there aren't clinics, etc. And we work with DOH to be able to see where some of the hot areas are, such where there's more problems we need to get to.
And DOH is your Department of Health?
Yeah, sorry.
Okay. That's all we've really got time for now. As you can see, it's generated a lot of questions. There's obviously been a huge amount of interest. Finishing this up now, there's really, all I need to say now is a very, very warm thank you to William, to Bootley, and to Andrew for sharing this with us today. The work of Shout It Now really is inspiring. I've been so moved by what I've heard today. And, to William and Bootley, I'm sure I can speak for the whole of the Simulate team when I say that it means so much to us to be able to offer our support and do what we can to help Shout It Now achieve its goals and improve the number of people or the number of clients that you are supporting. I also want to say thank you to everyone who is in the audience for joining us today. As I mentioned, more details can be found at the websites that are on the screen just now. So you've got Shout It Now on there. You've got an email and a website address if you would like more information, and also our Tech for Good programme. There is a link there. We hope to see you all again sometime soon, and just wish you all enjoy the rest of your day. Thank you very much for your time. Bye.